Hello, good afternoon. Happy Sunday. You're welcome back to the program. This is your friend Nurse Oke, and this is a program that we talk about health challenges, how we can prevent certain things, illnesses, diseases, and if you have any question, you have any addition, comment, reaction, or something, you can just inbox us, or maybe most of the time we leave our number at the end of every program. You're welcome once again. How are you coping with the COVID-19 lockdown? I hope it's not affecting you much. We are coping here fine too. Welcome once again. So this afternoon we're going to be talking about effect of too much sex. Like about 3-4 weeks now, we have dealt with effect of alcohol. That's too much alcoholic, too much smoking, effect of too much salt on your body, and we're going to be, taking effect of too much sex today. Some I want to ask, is it possible to have too much sex? Yes, I say yes, because it depends on what your own definition of sex or too much sex means. So whether you are in the honeymoon phase, or you are just you and your partner that just have decided, it seems you cannot just leave each other, you are just all over each other, you might be wondering if there's such thing that we can talk about too much sex. So the good news is that as long as you are there and both of you, the woman and the man, or whoever your partner is, you are happy and comfortable with the number of times that you have sex, there is no complaint. You won't say that you are having too much sex or something. But I want you to know that it has to be balanced. The both of you has to be on the same page, because you have to be happy with it physically, you have to be happy with it emotionally, and you can have as much sex as you want. But when it is affecting one for the other, we can say the other person can complain that the sex life is too rigorous or something for him or her. But there are certain uncomfortable physical situations that can arise from having too much sex. It's not only about enjoying it all the time. A lot of things can arise from too much sex. As we go on, you will see all these things. Then, number one, there are things that you have to look out for. Each person's definition of good sex, like I said, an issue in life is different. Why some people prefer to, they really do it. But some, they can have it as many times as possible, maybe monthly. It can be weekly, it can be daily, it can be yearly, whatever your own definition of sex is, and whatever your partner wants, that is what you can say that you are having a good sex. Then apart from that, or you might wonder how much is too much for your body or your mind to handle. Your mind might want to handle it, your body might not. At times, your body is willing, but your mind might not be, coping, especially when you are tired, when you are fatigued, or you are exhausted due to something or another. Even when you are not happy, as in emotionally, you might not want to cope. And that comes down to the reason why we say there is no limit to the amount of sex anyone can have, but there are a lot of physical issues and emotional issues that might arise as a result of having too much sex. Now, on the women part, the women are on the receiving side most of the time, because most of the time we don't really talk out, and besides, we are the vulnerable partner here. So most of the time we just want to keep quiet, and just because the partner wanted it, you just have to abide and go all along with him. So for the women, the first obvious sign is vaginal dryness. When you continue to have 1 or 2 times, 3 times, the woman, the wetness is no longer there. And what happens is that the woman becomes so dry, and the other time the man wants to penetrate, there will be dryness, there can be soreness, there can be itch. A lot of things can happen down there because there is prolonged, penetration and contact with this particular woman. And apart from that, it can lead to tiny micro tears. You might not really see it, but on the part of the woman's private part, you see some things like tears, and even if you want to wash it, to touch it, you see that there will be pains, that they call them tiny tears. They are there all around because of the prolonged time they have had, and it can be seriously painful, that even for the next 1 week or thereabouts, you don't want your partner to come near you. Then apart from that, it can lead to the urinary tract infection. The bladder has a lot of, how do I put it, a lot of adjunct. When you talk about bladder, we have the urethra as an adjunct. We have the urinary tract, that's the one, the tube that carries the urine. At times when you have a sex, there can be vaginal infection, and of course it can lead to the tract that carries urine can of course get infected. So the more sex you have in a short amount of time, it is better, because the natural moisture in your body is able to produce. But this causes friction when you are not able to produce much. So it is better when you haven't that. It's better to pee before, if it is possible, intra or even after having sex. Then apart from that, it could also cause irritation or rashes on the external skin around the external part of the private part of the woman. It can cause rashes, can cause irritation on the external part, and of course at times you see the other side, the place becoming swollen. They look engorged, as if you slap someone, when you it comes like that, and the private part, the vulva area, becomes engorged, and there's pain that even the opening of the vagina will not be able to open, and it will just be like that. It will be very difficult for penetration to happen. So it is very important, especially for the women, you pee before and after every sex, if it is possible for you. Then common signs of an infection include an increase in urge to urinate, and at times you feel peppery sensation. When you have this, you should know that you are coming down with infection due to prolonged sex. Then apart from that, there can be burning sensation while urinating, and that urine, most of the time you can see the urine coming down cloudy. They can have blood in it, or pinkish in color, as well as unusual discharges, pain, and odors. You should know that most of these things is not of them that maybe the man has gotten a sexually transmitted infection that is giving you. No, but this one, you will see that this is a sign of a prolonged sexual relations. Then apart from that, the psychological aspect, one or more of the partner might feel overwhelmed. You might think it's only the men that can feel overwhelmed by sex. No, but at times, the women rather, the men too can feel overwhelmed when you are trying to satisfy your woman the first time, the second time, and she still wanted more. Psychologically, you are not happy, you are not balanced, and you are trying to explain maybe, and you don't even want to explain, so that you will not look like a weakling, somebody that cannot satisfy his woman. So you are not psychologically balanced. You are only trying to maintain your sexual relationship, but it can be overwhelming. And of course, it can happen to the woman too, when all the man wants every time, in morning, afternoon, night, or every day, or even when you are tired, even when you are breastfeeding, when you are pregnant, he does not even have any consideration that let me leave this woman for some time. It's psychologically overwhelming, because you want to satisfy your partner, and of course it can lead to withdrawal when the other party that is not psychologically balanced, that is not happy with the status of that sex, starts to withdraw. When it comes to sex, they tend to withdraw from you. So number one, ensure that to check regularly with your partner. Are you okay with what we are doing? We have discussed what we say. We said something. We've done the topic, I think, sexual consent. It should be at every stage. Despite the fact that you are married to the person, they are not slaves, they are not your properties. They still have life, and they have their mouths to talk, or they are not dummies, they are not robots. So you still, at every stage you ask questions. Is this okay by you? Can we? Should we? You answer, and let them give you, approval. Let them get their consent. If a doctor wants to do a surgery on a patient, if the patient is underage, they take the consent from the parent. If the child is over 18 years, according to Nigeria Constitution, they move on to the child, talk to him or her. This is what I want. But that is seeking consent. You cannot say you want to amputate my leg and you're not telling me anything. Just take me to theater, and of course you are going to be liable. So when it comes to sex, there should be sexual consent. It is their own sexuality. Let them decide what is good for them, not you lording it over them that I'm your husband, this is what I want, after I'm your wife. It's not going to be possible. It's not all the time that you are psychologically ready to have sex, or at times you are not physically. You might be psychologically sound to even have it. You come from work, you have some stress, and your body does not really want it again. So it has to be balanced. Ensure you continue to check with them. Is it okay by you? Are you happy with what we are doing? Is it that I'm the only one am I forcing you? Ask questions. You are used to your partner. You know how you can get him or her to talk. Ask and answer. Ask them questions and let them ask. Then don't use sex as a way to resolve issues. Most of the times, I used to do it in my marriage when we have problem. We just have sex and sleep over it. Like that, it continues over and over again. Then when I got to a stage, and I'm also always at the receiving end because I'm not a confrontational person, but I got to a stage, the center could not hold water because I felt all the things I needed to talk, I could not talk. So I blew it out of proportion and it became a problem. So don't settle issue with sex. If you have any issue in your relationship, talk and settle that. Not immediately we have sex, everything is over, we should not talk about it. No, it's not going to solve the problem. Rather, it's going to add fire to the already burning situation. So you don't do that. You have to talk about it. Then apart from that, sex should be a source of pleasure, which is it, and pleasure and vitality, and it's natural to have a strong drive for it. Nobody is complaining. Some have low sex drive, some have high libido. Nobody is complaining about that, but you got to balance it. If you are the type that keeps a partner and you are not this going all around, it has to be balanced. You understand? As in 50-50. Not if it's not 50-50, then one partner has decided to play a dummy just to allow peace to reign. She might not be happy after all. Then apart from that, if you find that you look for sex compulsively, there are some, we all have sex drive, but at different levels. Some have 50%, some are, but if you are now, there's something we call obsession. When you are obsessed with it, you don't have nothing in your brain, sex, then maybe you are going toward, having psychiatry issue that you have to see a psychologist, a counselor, or even a psychiatrist to help you, because that is another thing. And when I talk about compulsive sex, is when you have issues at work. Instead of resolving that issue, you have issue with a friend, you have issue, with a family, and what you want to do at that time is to have sex to resolve that issue. That one is going out of proportion. It's not the right thing. So you got to look for a psychologist to talk to, and so they can help you. Then apart from that, on the male part, they have irritation. There can be pain if you continue to ejaculate severally. As the penis has bones. You can go and read about it, or you ask people questions. There is bone there. So at times when you continue to, have sex with no respite, you are just like that, you can have pain in that your penis. There can be soreness. There can, apart from that, when you continue to ejaculate, like say over the weekend, Friday to Sunday, you have, you're at home, like this time that we are, this total lockdown, and all you want to have is sex about 6 times or 8 times, 10 times over the weekend. Of course, it's going to be there's going to be some pain and of course discomfort, because because it is very, very extreme, and because you are not allowing your body to rest. So it's going to be, you're going to have pain, and we are going to be talking about the kind of pain you have and all that. Then apart from that, exhaustion, when you have too much sex, it affects the quality of your life. Sex is an activity that uses a lot of energy. We all know it. You burn a lot of calories during sexual intercourse. You're like there is an hormone, they call it adrenaline, and cortisol. They are released into your bloodstream, and of course they can lead to that time. They can lead to increase in heart rate, and when there is increase in heart rate, there can be increase in blood pressure, increase in muscle strength, and of course your glucose metabolism will get increased. And they are all what you do. If you do them occasionally, the better for you. But if you continue, if you are the type that does it, by the time all these things, their product might not be able to move out of your system, and what happens? You can come down with high blood pressure. You can come down with increased glucose metabolism, diabetes mellitus, increased heart rate, heart attack. A lot of things. They are so tiring because you are exhausted. It's as good as you want to run 500 meters. Yes, with the energy you spend like 300 meters to run a race of 300 to 500 meters is the same energy you spend when you are having sex on your bed, even on the wall or whatever, wherever you are having it. Then apart from that, there is dehydration. Some couple, you have to take enough water if you want to have sex. Enough water. You have to, because most of the time we sweat during sexual intercourse, and of course there is dehydration. So you got to take enough water, maybe before, if it is possible, during, and of course after. So because if it is an activity. It is an activity that is, it takes a lot from you, except you're not having it the way you want to have it. So you should make sure you stay hydrated. Drink water. Then how much sex you have is up to you, whether the weekly, the monthly, the yearly, or even never at all. But the point is, remember, there should be consent between the both of you. Then when it comes to the frequency of sex, each person have their own preference. Of course, the preferences cannot be limited by your schedule. Like me? I work during the night. So we are going to, my husband and I have to plan. Is it going to be during the week? Is it going to be the weekend? How do we, you have to plan so that it will suit the both of you, and it depends on the availability of your partner. You cannot have it all alone. Then you have to continue to check and ensure that the both of you are on the same page. Then another point here is lower back pain. You see some men, especially in this part of the world, they have this lower back pain, and all they can take is Chelsea drink, this oxygen, alcohol, locally made one, and all their aim is they want to cure the lower back pain that they are experiencing. And most of the time it does not really work, because as soon as the effect of the alcohol you've taken or the concussion wears off, you are back to square one. It's just like somebody taking alcohol because he wants to forget he has a problem. Immediately the alcohol wears, the effect wears off, you are back to your problem, staring you right in the face. So we're going to have this long session of trusting in and out, penetrating in and out, of course, leads to lower back pain, because it's often caused by stretch. When you overstretch the muscles of that particular place, which is lower back, that it can be torn, it can be pulled, and when you pull something, it's like you are holding something that is elastic in nature, and you are trying to pull it. Of course, you are going to have to, extend the size of what you are pulling. So that is what you are doing to that lower back when you continue to thrust in and out, all in the name of having sex. And of course, when there's too much stress during sex, it can lead to lower back pain and poor sex position. It's not all the positions that are good. So forget about what happens in pornography. It's not, I will not say it's not ideal. Some people might like it, but most of the time it's crazy, because when you want to pattern that, and come and bring it and practicalize it in your home, it might be a problem on your partner. It's not all positions that are good for your back. Poor sex position over time also leads to lower back pain. So lower back pain is not all about concussion. It's not all about, and the way we score, the way we sleep, the kind of bed we sleep on, it leads to a lot of back pain. Then apart from that, there is weak immunity. When your immunity is low, you see that with this COVID on ground now, the researchers have been telling us, the countries that are mostly affected, they have been telling us that most of the people that have been losing their lives are adults, over 50 and all that, simply because their immunity is low. When we are much younger, the blood cells, the white blood cells that are like soldiers of our bodies, they are there, they are functional. Most of the hormones in our body, they are functional, and they, of course, gather together to, build up our immunity, so that when external invasions that are coming, like infections, bacteria infection, fungal infection, they fight them first. So if the body system is not able to resist those things, then you come down, like, for example, like boil, or you have hair discharge, you have pus in your hair, the body must have fought, or even sore throat. Most of those common bacterial infections that we have, the body must have fought. But when it gets tired, then just decide, and what happens? You come down with that particular infection. So, but as time goes on, when you have too much sex, let me tell you the physiology. The physiology is that basically something like prostaglandin, there's something in our bodies, an hormone, we call them prostaglandin. And this prostaglandin is an hormone, most of the time, especially an hormone for pain. When, for example, an accident occurs right now, and this place, I'm able to, maybe I'm involved in an accident, and this place becomes inflamed. This place I was hit by something and becomes engorged. There is inflammation. Then the prostaglandin comes, because it is part of the hormones that want to help me, because he's trying to start his own impulses to help me heal this place. So a lot of fluid, a lot of water, a lot of serum and prostaglandin, or a lot of hormone are coming there. It's because they want to help me, you understand? And most of the time, as they are coming to help me, to help the tissue that has been spoiled, they might not leave your system. Then when you are now having sex, most of the time, because this hormone is constantly present when you're having sex, it will be there, and it continue to lower your immune system. It continue to lower your immune system, continue to lower it, and before you know it, if somebody coughs just beside you, you pick it up. If somebody is HIV possible, and you now become like a dustbin that somebody can just come and dump something. Viral infection comes, you pick it up. Bacterial infection comes, parasitic infection comes, you pick it up. Fungal infections come, you are there, because you have a lower immunity, all in the name of too much sex. Of course, it can also lead to lack of sexual stimulation. You have had sex, and you are just tired. The feelings are not there. You are being touched. There's no feeling. Somebody touching you, you're touching someone, they are trying all they could do, but there is no stimulation because you have had your own quota. That's what it means. So we just have to be careful. Then apart from that, the penis itself can become sore, sore on the penis. Then at times, if you ejaculate forcibly, most of the time you want, I must do it. Maybe after the first, the second, or the third round, you have had your ejaculation, and you still want to go the fourth round. Then the fourth or the third round might be a forcible. You are forcing the ejaculate to come out. Of course, it can lead to contraction, which in the process of contraction you can have pain, and you can even break the bone of the penis. The penis has bone, I'm telling you. Then apart from that, unwanted pregnancies. You are not ready for this, but because you cannot control yourself, you just want to have, you don't even know when the woman is safe, you don't even want pregnancy, but of course you are coming down with pregnancy. So that is one of the side effects of too much sex. And apart from that, you have infection in the testicle. When you look at the male reproductive system, you see the penis right there. Then there's some things like ball, or all those, right below the penis. All those ones, they have the testes, the testicle, but they are not something that you can see outside like the way you will see the penis. Of course, they can come down with infection. Your prostate can come down with infection. Your urethra, that is, and in men, they have the only urethra they have. That's where the urine comes out, and that's where the sperm passes at the same time. So if anything happens, it is very easy for them to have infection. So all those urethra or a sexually transmitted disease, of course, that you can get, all in the name of too much sex. Then trouble finishing or reaching climax. A male semen's level and sperm reserve tends to go low when you have continuously, and if you don't give your body rest, especially for the men now, after time to recharge, like you have used your phone, you need to charge it, or if you don't give your body time to recharge and relax, of course you will have trouble either finishing what you have started or even reaching the climax and ejaculating, all in the name of that. So you got to give yourself, slow it down, and give yourself time to recharge. It is a normal thing to have lot of it is not normal to have a lot of sex within a very short time. It's not. You might say it's feeling, you might say I love him. It is not. You have your brain, it's a physical activity, like I said. It's like you are running like 300 to 500 meters. You can calculate that. You know what it means. That's the energy you are spending on your bed. So you got to relax and make sure. Then of course, heart attack can of course happen. You see most of the time and you see most of this, in this part of the world, you see on the social media, you see some women married, some men, married men, that they are not satisfied with their wives at home, and they move out to go and meet younger girls, all in the name of sex. Some of them will take different kind of tablet, and at the end of the day, you see them because they had heart attack, and there was nothing that could be done. Before you can say doctor, they are already gone. But if you know most of these men, it is not common for you to see that a man is sleeping with his own wife in the house and dies, because they know their level. Everybody, you understand your partner over time. But the girl outside, you want to give it to her because maybe you are paying her fees, you are paying her bills, and you want to make sure. So most of them go out there and take drugs. At the end of the day, what happens? They die. And the woman lives. The children continue to live their life, no matter the circumstances. Life continues. Then, that is the last one we're going to talk about is stroke. Stroke is very, very common with people that have excess or too much sex. So, what we are saying is that health is wealth, and prevention is of course better and far, far cheaper than taking care of ourselves. So try and let everything be in moderation. In moderation. Sex is psychological. It doesn't feed you. So don't kill yourself. If you have any question, any addition, any reaction, you need clarification, just talk to us. We are here for you till I come your way next time. Remember, staying healthy is staying exclusive. I'm your friend, Nurse Oke. Have a lovely time. Bye-bye for now.